Welcome to this LEX18 Digital Conversation. I'm Davidson. Many of us are walking around here with chronic pain. While that pain has a purpose, getting to the source and treating it can be a whole nother issue. Joining me now is Dr. Danish Mazlumdos from Wellward Regenerative Medicine. Thank you so much, Doctor, for joining.
Thank you for having me, Dia.
All right, pain. We all live with it at some intensity level or not. What can we do besides popping a pill? People don't want to pop pills anymore.
Yeah. You know, it's a universal experience. Everybody's going to have pain at some point in their life,
right.
And it's just the way your body communicates things to us. So I view it, rather than viewing it as a problem or a nuisance, I view it as a signal that we need to figure out what the message is trying to be relayed. So it's more a matter of understanding the utility of pain and then following down to the root cause to address that and figure out how to heal that problem.
Well, the biggest pain is going to be a pain in my back, right? Or a pain in my shoulder. What would be sort of the first thing I would have to do coming to you to get some relief? Yeah,
back pain is the #1 reason that people go to the doctor. It's actually universally across the globe. Right. So, you know, we've developed a framework that we call the HEAL method of treating pain. H stands for hearing the message that your body's trying to say, essentially figure out what that pain is trying to relay. Mm-hmm. E is for envisioning what you want, or essentially what are your goals? What do you want to get out of treatment, or what are the limitations that the pain is imposing? A is to alleviate the pain, meaning reduce the symptoms, but bear in mind that it's not eliminate the pain. We have to recognize that the pain has a utility, and if we understand how to interpret the message, then we can actually start to heal. And so L is to leverage what the body normally does to heal in ways that can augment or amplify that effect and actually get the problem to go away.
But as we age, that healing takes different turns or different time periods. So is this something that is for just a younger person, or can even senior citizens look to this?
So regenerative therapies have a lot of have a reputation with sports athletes, but the reality is that the older we get, we do have fewer and fewer repair cells, or what we call stem cells, out in the periphery or in the body. However, with newer technology, we can take your blood, for instance, or take various parts and isolate and concentrate those growth factors so that we're doing something that your body used to be able to do when you were a kid, but now we're doing it for you as an adult.
So are you using any foreign matter, or is this all just what's in me?
It's all what's in you. We're just concentrating it.
And so there's no rejection?
There's no rejection. Oh. I think the trick, though, is you have to know what you're dealing with, what you're trying to fix, and then you have to know where to put it. And so that's where some of the advanced sciences come from. It's not as easy as just, you know, injecting it somewhere.
It here, right.
You have to really understand the mechanics of the body, the neurological relays of the body, because if your knee is hurting, it's not always your knee that's the problem. Right. It might be the ankle that is changing how you walk and putting stress on your knee.
So you might be treated for something that really isn't the root cause.
Right. So we have a process we go through called pain mapping.
Okay.
Where that's exactly what we do, is we're actually mapping out what that pain signal is trying to tell you, and figuring out, is this a mechanical problem coming from the joint, or is it a nerve problem, or is it a problem of signal interpretation at the level of the spinal cord or the brain? So all of these things can be involved in a pain problem. And
from start to finish, though, how long of a process is this? Because this sounds like this is not just I roll in the morning and you do a procedure and then I'm done.
You know, it depends on what's wrong. I mean, there are things that we can treat right then and there. But when we're dealing with chronic injury, it took a while for you to get there. So it's going to take a little bit of time for you to get out. But generally, we see a pretty rapid response within 3 to 4 weeks of a regenerative treatment. People are actually noticing sustainable improvements.
Now, with this, do you also use, say, physical therapy along with it, and exercise?
Absolutely. Yeah. I mean, things don't happen in isolation, so they're not going to repair in isolation either. This is not a one-size-fits-all for everything. We have to couple it with other modes of therapy, like physical therapy. And I'm a big believer in physical therapy. I mean, your body heals through that process of breaking down weak or damaged tissue and then building in new tissue that's healthy. And that's essentially what physical therapy is doing.
But now if a patient needed or requested, say, the traditional forms of medicine, you were able to take care of that as well, right?
Right. So we do the full spectrum. I mean, we do traditional pain management. However, we take a different perspective on the pain medications. I don't see the medications as being sustainable. In fact, I see them as being harmful in the long run. Not just because of the addiction problem. People always concentrate on that,
right.
But really it's because it changes the way your body perceives pain, so that somebody without pain medicine, both sides are going to hurt with or without pain medicine.
Right.
But somebody without pain medicine will fluctuate like this. Somebody who's taking pain medicine, they get that relief, but when the medicine wears off, you actually become more sensitive to pain, because it's like your brain is recognizing the pain signal is there, it just can't hear the message, so it turns up the volume.
Wow.
So I view medications as emergency medicine,
right.
But we offer the full spectrum of pain solutions. However, we have this added element of what we term as non-surgical orthopedics, where we're actually fixing things that would normally be seen by a surgeon. We're able to avoid a lot of those surgeries through these regenerative techniques.
Wow. You have a book that has a very interesting title. Call it 50 Shades of Pain, How to Cheat on Your Surgeon with a Drug-Free Affair. Let's talk a little bit about the book, and when do patients actually get a chance to grab a hold of one of these?
So they say don't judge a book by its cover, but in this case I kind of do invite that, because I think it is a catchy name.
Right.
Essentially what we're talking about is healthcare has gone in a certain direction when it comes to managing pain. And I view that as a very problematic approach, because essentially we're using the difference between a lead variable and a lag variable. A lead variable is something that's hard to measure, but it gives you insight into the future, whereas a lag variable is something that is easy to measure, but it gives you insight into the past. Right. We view health as a disease-based approach. I mean, not we, but healthcare is a disease-based approach. It's looking at a lag variable, which is a problem, and then seeing what they need to do to fix that problem. Well, my perspective is we need to change the view of healthcare, where we're looking for the lead variables. We're trying to see insight into people's future based on problems that are presenting now. So the premise of the book is, let's completely throw away the model that we have of how we address pain and look at it from a much more fundamental level. And when it comes down to it, it's that pain is a signal that we need to understand, that we need to change how we approach it and how we try to treat it. And that's where the HEAL model or the framework comes in, is trying to provide that model that healthcare then uses in different contexts to really
but that's
understand.
going against the big machine, the medical machine, isn't it?
I hate to say it, but I think it is. I mean, I think that medicine can sometimes get into a silo where you're just oblivious to everything else that's going on around you. And then you just start to dig yourself into a hole, and that's what's happened within my field.
And then forget about the holistic approach to medicine.
Absolutely. I mean, pain doesn't happen in isolation. It happens because of injury, because of diet, because of exercise, because of lifestyle and work habits. All of these things really go into understanding how to treat somebody's pain in a more sustainable, long-term fashion.
And sadly, some of it can be genetic, right?
Genetics it's true, but I always tell my patients, we're not trying to make you the best that's possible. We're trying to make you the best of who you are. Optimize your health. And really the reality is that we all age. We all get humbled by the changes that age imposes. But we can still live our life to the optimal level, and that's what we're here to help with, is try to help people live their optimal life.
My grandmother used to say it with everything. She said, just live a little bit. She said, if you don't have that ache and pain, live a little bit, and then you'll have it. And as I noticed, getting up out of the bed sometimes is not just like I used to do when I was 20, and so it takes a little bit more time. You also, it's not just pain that you treat. You also treat other issues that people may have, especially as we grow older. Let's talk a little bit about some of those. And I think you have a Valentine's special that you said you wanted to talk about too.
Yes, absolutely. So, you know, we use pain as a starting point because it's a marker of something that's going wrong. But there are other things that the same technologies, the same regenerative treatments can be applied to, one of which is sexual regeneration. I mean, as we age, our blood vessels become looser. Right. Yeah, right. They don't function as well. Our nerves don't transmit as well. All of that goes into the problems that develop as we age from a sexual function standpoint. I view that the body is, every component of the body is important, and sexual health is just as important as mental and physical health. And
but now how can regenerative help? Because if it's just kind of one of those things that happens with age, it's not like somebody who's 80 can be 40 again, right?
Maybe not 40, but certainly 50 or 60.
Okay.
It's using the same tools and techniques that help to stimulate, say, joints and arthritis or cartilage repair, but using it on the level of nerves and blood vessels in your sex organs to help with, you know, erectile dysfunction or women who develop stress incontinence. Right. It can help with regenerating some of the muscle tone, the blood vessels, the nerve stimulus. All of those things can be regenerated and improved upon.
So are we talking about a pill regimen, or are we talking about injecting of stem cells again?
Right, growth factors in this situation. So it's growth factors that we get from your bloodstream, and then we use to inject those parts of you. And it sounds daunting.
Yeah.
But you know, my background is in anesthesia, so I'm able to numb the area so people really don't feel anything.
Wow.
And it's
until they feel the benefits.
Until
I guess.
they feel the benefits, right?
Right.
Absolutely.
Now you were telling me about is it an L procedure and an O procedure?
Yeah, so the terms are the O shot and the P shot.
Oh, the O shot and the P shot. Okay.
Right. Yeah.
All right. What's an O shot and a P shot?
O shot, it's for women.
Okay.
Orgasm shot.
Okay.
P is for priapism or essentially male shot.
Okay. So for erection.
Right. Okay. Right. But they're just trademark names that are specific procedures that help to stimulate these.
How often would a person have to have these types of injections, or is this sort of once every 6 months, once a year? What are we looking at?
So it can be once in a lifetime.
Oh.
The thing is that we're aging every day. Sure. So, you know, whatever advances we make today can be undone in the far future. But I've had patients where we don't really see them back because they're doing so well. And I've had patients who do require some upkeep and come back, say, on an annual basis or biannual basis.
Are you doing it in tandem with, say, like a Viagra or for some type of medication that a woman may use as well?
In some of these cases, they're able to put that medication aside.
Really?
Yeah, we're really regenerating the tissue that's in that area.
Huh. So now if people are interested in that, what specials are you offering on that?
So actually February, we're going to have a special for both of them.
Day,
Yeah, exactly, right. Because we want to focus on the whole being.
Right.
So we're going to have a special for both the O shot and the P shot. And you know, this can be a taboo or an embarrassing topic. So this is something that we just mix in with the rest of our patient population. So it's not as kind of you know, I'm coming in for my O shot today.
Right. Well, you know, I was looking at some literature, and they had an interesting statistic for Valentine's Day. They said 1 in 5 men is hoping for sex on Valentine's Day. So if this is an issue for someone, then this might be something that they would want to consider doing either themselves or with their partner, right?
Absolutely. Human connectivity, that's really a mainstay of life, and this is a medium by which people can connect.
And for some people, it's self-esteem too, isn't
Absolutely.
it?
Yeah. Yeah.
Doctor, we were talking about health insurances and things of that nature. This is something that someone would have to privately fund, right?
Yeah, there are some services that it's just cutting edge. It's not something that insurance has adopted yet. I'm confident that in time it will, because the cost savings compared to the alternative are really tremendous. And particularly, we're in an age where people have such high deductibles that essentially they are self-insuring or providing their self-care.
Right.
So, so yeah, the trade-off is that sometimes some of these procedures are going to be an out-of-pocket expense,
Right.
but we're also not quite used to investing in ourselves. And I believe that your body is your most intimate, most valued possession.
Yes.
The more you can take care of it, the more it's going to care for you. And investing into your future and to your health is about the wisest investment that you can make. I don't say that from a biased perspective, although it is.
Yeah.
But really, truly, that's how I live my life, is trying to make the most out of this body and try to bring the best of that to the rest of the world as well.
Yeah, because this is the only one we get, right?
You only get one.
You only get one.
Yeah.
Doctor, it's always good to see you. Thank
Same
you.
to you.
And thank you for joining us for this LEX18 Digital Conversation. For more on our digital conversations, just log on to our website, lex18.com. Also follow us on Facebook and Twitter. Until next time, I'm Dia Davidson.